Shah, the director of the Maine CDC. I'm joined this afternoon by Commissioner Jean Lambrou from Maine's Department of Health and Human Services. Commissioner Lambrou and I are pleased to be with you today to talk about where we are with COVID-19 for the entire state of Maine for today, Wednesday, October 20th, 2021. And we begin our update today on another sad and somber note. The Maine CDC is reporting the deaths of 7 additional Maine people with COVID-19. 3 of them were residents of Cumberland County, 2 were residents of Franklin County, 1 a resident of Kennebec County, and another a resident of York County. 5 were women and 2 were men. 1 was in their 60s and 6 were in their 70s. We'd like to take a moment to offer our condolences to the friends, family members, and communities of those who have lost a loved one. Right now in Maine, there are a total of 99,256 cases of COVID-19, an increase of 649 cases. In terms of hospitalizations, 2,691 people have been hospitalized since the beginning of the pandemic. And right now in Maine, there are 199 people in the hospital. To put that number in context, 2 weeks ago, or 1 incubation period ago, there were 166 people in the hospital in Maine. This represents a 20% increase in hospitalizations just in the past incubation period, or 2 weeks. Similarly, right now in Maine, there are 68 people in the intensive care unit. 2 weeks ago, that number was 51 people in the intensive care unit. Right now, there are 34 people on a ventilator. 2 weeks ago, that number stood at 21. It continues to be the case that statewide, about 2/3 of everyone hospitalized in Maine with COVID-19 has not been fully vaccinated. In addition, the US CDC just today released data indicating that nationwide, for all adults, the cumulative hospitalization rate is roughly 12 times higher in unvaccinated individuals compared with vaccinated individuals. Say that again. Nationwide, the risk of hospitalization with COVID-19 is approximately 12 times greater for individuals who are not vaccinated as compared with those who are vaccinated. Turning now to testing. Our PCR positivity rate on a 7-day basis now stands at 5.3%. 2 weeks ago, the positivity rate was 4.3%. In terms of testing volume, we are steady there. Today, the testing volume for PCR tests stands at 505 for every 100,000 people. 2 weeks ago, it was 504. In terms of vaccinations, Maine right now is doing about 3,900 shots in arms per day right now. But there is variation in that number among first, final, and booster doses. Of that 3,900 on average right now we're doing, about 588 are first doses per day. About 1,180 on average are second or final doses per day. And we're doing about 2,140 booster shots every single day. To put that in perspective, that means that right now, over the past week, about 55% of the vaccination in Maine comprises boosters. On a population level, just a hair under 70% of the total population in Maine are fully vaccinated, just a shade under 70%. So about 7 out of every 10 people that you meet on the street, irrespective of their age, are fully vaccinated. Similarly, about 75.5% of every single person in Maine has had at least 1 dose. And before I turn things over to our colleagues in the media for questions, I want to provide 2 updates on where things stand with vaccinations, generally speaking. The first is a brief update on boosters, and then the second, a brief update on vaccination of children aged 5 to 11. Let's start with boosters. Right now, as we are talking, there is an expert advisory committee convened by the United States CDC to discuss the scientific data around boosters for individuals who got their Moderna shot or their J&J shot. This meeting comes on the heels of meetings that the FDA convened last week, where its advisors unanimously recommended that boosters of those two vaccines, Moderna and J&J, be made available. The US CDC's group is meeting right now to provide clinical recommendations around that regulatory vote. Nothing has been decided yet at the federal level, but in the coming days, we may see the acting FDA commissioner, followed by the US CDC's director, signing off on boosters, both for those who received Moderna and those who got J&J, for a wide group of people here in Maine. The groups at issue for the vaccines are slightly different. For those of you who got the J&J vaccine, which is everyone over the age of 18 who was eligible, the recommendation may be that everyone who got the J&J vaccine get a second shot. For the Moderna vaccine, the recommendation will likely track the same groups that have already been authorized for a booster of the Pfizer vaccine. Those, for example, who are 65 and older, those who have pre-existing health conditions, or those whose workplace exposures put them at a higher risk of COVID-19. We'll know more about that in the coming days, but I ask everyone to stay tuned, because when there's news, we'll try to make sure that everyone is made aware of it via social media and other channels. But if you are in those groups of folks who got Moderna or Johnson & Johnson, this may affect you, so please stay tuned. The other update that I wanted to offer is where we stand with respect to childhood vaccinations. Next week, that same advisory committee of the US FDA will be meeting to discuss the data that we have around the authorization of Pfizer's vaccine for children in Maine aged 5 to 11. That meeting is happening on October 26th. The week after that, on November 2nd and November 3rd, the same group of advisors to the US CDC will be meeting to talk about those same data and potentially offer clinical recommendations for whether and under what conditions children aged 5 to 11 should get the Pfizer shot. The state of Maine has already been working to roll out vaccines for children aged 5 to 11 if or when they are authorized by federal health officials. In particular, Maine DHHS has been working closely with Maine's Department of Education, as well as school districts across the state, to plan and prepare for the possible arrival of the Pfizer vaccine. We can talk more about this, but we're focusing our approach on making as many channels available for vaccination as possible. The mainstay of that approach will be school-based vaccination clinics, which have been used in Maine going back to the H1N1 era, as well as more recently for things like influenza clinics. But we're also going to be supplementing that with other available channels. For example, commercial pharmacies in Maine will also have the vaccine and be able to administer it. To say nothing of your own doctor's offices, pediatricians, and family practitioners in Maine. We're working with them to make the vaccine as widely available as possible. To say nothing of other clinics that might be set up. For example, Commissioner Rambrou and I are working with hospitals and healthcare systems in Maine to try to offer clinics not necessarily connected with schools. And as a reminder, two of the large-scale vaccination clinics remain open. The clinic operated by York County Emergency Management in Sanford, as well as the clinic operated in partnership with Central Maine Healthcare at the Auburn Mall. They will remain open and will be offering the Pfizer vaccine to children aged 5 to 11. There's going to be a lot more information about this next week and the week thereafter, but I wanted to provide everyone a status update about what we know today. With that, we're going to turn to questions from our colleagues in the media. To our media colleagues, we have 13 folks today. Commissioner Rambrou and I have just until 3 p.m., so we're excited to go through as many of the questions as we can. The first question today goes to Brian Sullivan.
Okay, Dr. Shah, sticking with boosters, I wonder if you could give us a little information about best policies if you are a fully vaccinated person, and what would be if you started with Johnson & Johnson, for instance, should you get the second shot of Johnson & Johnson, or is there a mix and match scenario that might be better for you long-term?
Sure thing, Brian. I'm going to start with the latter question. There is a lot of interest, and there has been a lot of discussion and advocacy around advocacy on the part of states to allow for a more permissive approach toward mixing and matching of booster shots. So if you got your first shots of Pfizer, getting a booster with Moderna, or vice versa. In addition, Brian, the scenario you mentioned, if you got your first shot of J&J, getting a booster with one of the other vaccines. This has been discussed by the US FDA and the US CDC. Personally, it's something that I happen to be in favor of based on the data, as well as the logistics of making boosters more easily accessible. But until and unless federal officials sign off on that strategy, there's not much here that we at the state level can do. It's something that I believe is good scientific policy. My colleagues and I in other states have had productive discussions with federal health officials. We know it's under consideration, but until they make a final decision, thumbs up or hopefully not thumbs down, there's not much more we can do. Brian, could you explain to me what you meant by your first question?
It was so long ago. I feel I guess the best course of action, if there was, in your opinion, a great cocktail, to make an Arnold Palmer of vaccines, I guess.
Yep. Brian, I'm going to hold on answering that until the time that FDA and CDC make a policy decision and a scientific evaluation of that. I've seen some of the data; they're publicly available around the efficacy of mixing and matching. They are encouraging data, but in terms of specific recommendations, Brian, I'd rather hold on that until everything has been voted upon and we know that we're moving ahead with that.
Okay, thank you. And one for you, Commissioner Lambrou. I know for these briefings we've cited a healthcare worker shortage even before the pandemic, but we have seen some instances where the vaccine mandate has been listed as a reason for a worker shortage. Lincoln, a nursing home there, losing 60 beds because they don't have the people. Does DHHS have concerns about the landscape after next Friday? And I guess just your feelings about the landscape that the state's currently in.
Sure. I do want to begin with the fact that we have seen significant improvements in the vaccination rates in our hospitals, long-term care facilities, and just today, the Department of Public Safety reported that 97% of the EMS workers subject to its rule are fully vaccinated. So we do know that vaccine requirements do work in these healthcare settings where, as a reminder, they're high-risk settings. These workers are putting themselves at risk. We've seen over 6,000 healthcare workers in Maine get COVID-19, as well as patients. Entirely too many people in Maine have been exposed to COVID-19 in our healthcare settings, which is why this matters. But going to the workforce challenges, we do continue to work aggressively. That includes providing flexibility where possible. So, for example, we work with facilities on staffing ratios or on-the-job training. We provide financial support. Just this year, we provided $25 million in August to hospitals and nursing homes, another $143 million this fall. We're working on behavioral health providers as well in terms of providing them with financial support so they can pay those retention bonuses, pay those recruitment bonuses to solve these short-term problems. We offer recruitment resources, connecting them with the Department of Labor's job links or career centers, our universities and community colleges that have students ready to go. And we also work with them on retention. How do we support, for example, those workers who need childcare? We have great new childcare options on the table this year that we're working with facilities on, housing support programs, as well as resiliency support. We know it's been a real challenge during the pandemic to day after day care for people with COVID-19 or patients in full PPE. So in addition to our Strengthen Me program, we also maintain a Maine Frontline Warm Line for healthcare workers, emergency responders, other frontline staff that gives them support for dealing with these pandemic-related issues. So we do continue an all of the above strategy to try to solve these short-term issues. The governor also is committed to trying to do both, solve in the short run these problems, but prepare for the long run. So the Maine Jobs and Recovery Plan does have nearly $20 million in it for healthcare workforce, and I expect you'll be hearing from the governor very soon about that.
Thank you both.
Thank you.
Thanks, Brian. Chris Costa, over to you.
Dr. Shah, Commissioner Lambrew, thanks for the time. Looks like the numbers for the school staff vaccination rates were just updated to 79.7% statewide, and that's just for the school staff, not including the central operations staff. I was wondering, and I guess this is probably more a question for the commissioner, but Dr. Shah, obviously would love to hear from you too. Your reaction to the progress there. I think it had been around 75.8 or so percent during the last reporting period. So I just wanted to get your reaction to that.
Yep, I'm happy to do so. It was 75.6% in the last reporting period. So we are so encouraged by the progress that our school staff, our school leaders have made in vaccination. That increase from the end of August to the end of September is larger than the increase in vaccination rate for all adults in Maine, which is progress. We do see the variation in counties continue. Cumberland County continues to lead on the school staff side, going from 89% to 91% of its staff fully vaccinated. Waldo County, which was the lowest, did a big jump. It went from 61% to 86%. Piscataquis County is now our lowest, but even Piscataquis County went from 63 to 68%. So we are encouraged by the progress that we see in schools. A reminder, as Director Shah just said, we are really excited to be working very much in partnership with our schools to get ready for the next vaccination opportunity, which is for those kids ages 5 to 11. In the next 2 to 3 weeks, we expect to hopefully to get that approval for those vaccine doses for those younger children. We'll be trying to work with schools on school-based clinics or other sites for those children to have the opportunity to be vaccinated. And as a reminder, our whole goal is to get as many of those children their first shots in early November so they can get their second shots in time to be fully vaccinated by that winter break around the holidays. So we are very grateful for our partnerships with our schools. We are excited by the progress we see in the school staff vaccination, and we really do look forward to seeing more of the students be vaccinated as well.
Excellent. Anything to add, Dr. Shah? I noticed you unmuted.
No, that was okay. Nothing more from me, Chris.
I guess my second question was, and I know that Northern Light has been putting out these graphics that show their hospital patient census. They've started to add some more data around that, showing the breakdown of age, in addition to a person's vaccination status if they end up in the hospital. Dr. Shah, when we've talked about this in the past, one of kind of the limiting factors has been the, I guess, population size. When we talk about, 15 out of 39 patients are vaccinated, are ending up in the hospital, that percentage can sound like, a large number. 15 out of, 40 is what, almost 50%, 45% or so. So I just wanted to kind of get your reaction. I mean, I don't want to downplay the numbers, but I just wanted to kind of get your sense on what do you make of those numbers when you see that proportion of people who are vaccinated out of the total hospitalization census of people positive for COVID-19?
Sure, Chris. First of all, I want to give a shout out to Northern Light, as well as other hospital systems in Maine that are producing the same level of data and infographics on a daily basis. I think that's a welcome addition, and I'm thankful that they're doing so. Chris, you make a good point, which is the percentages don't necessarily tell the full and complete picture or give us the full and complete picture. Knowing the raw numbers is really, really critical as well. That's one reason I try to couple statewide numbers with the number of people overall, so folks can have a sense of what this means in real terms. But make no mistake, Chris, I mean, I'm still, notwithstanding the fact that it's small numbers, it's concerning. Hospitalizations for most folks can largely be avoided if they are fully vaccinated. And so the fact that we still have 2 out of every 3 people in a hospital in Maine who's hospitalized with COVID, who has not been fully vaccinated, that's concerning because much of that hospitalization is something that could be avoided, and those individuals could be saving themselves the anguish of being hospitalized. Do people who are fully vaccinated get hospitalized, and do they get COVID? It does happen, but it's important to note that to this day, about 99.3% of people in Maine who have been fully vaccinated have not had COVID. So it's just another testament to how good the vaccines are.
Certainly. And just to follow up, just because I wanted to make sure I'm understanding this. A few weeks ago, I mean, even within the last maybe 2 weeks, we were talking about numbers of 90%-ish of the patients in the hospital were those who were unvaccinated. Now we're today talking about closer to 2/3, which is about 66%. That to me seems like a significant difference. Can you explain why we're seeing that? Is this a need for boosters? Yeah.
No, mathematically, Chris, most of that is driven by the fact that we just have so many more vaccinated people. It goes back to this base rate effect problem or phenomenon that you see in a lot of different fields. The number of people who are vaccinated is just so much higher. So when something that's rare, hospitalization after getting COVID in someone who's vaccinated, if it happens in a much larger group of people, like the percentage of people in Maine who are vaccinated, it'll appear as if it's a growing problem. But the real question here is, what's the rate? What's the rate of getting COVID if you're vaccinated versus if you're unvaccinated? That's why, Chris, I thought that recent data from the CDC was instructive. The 12-fold higher risk of landing in the hospital if you're not vaccinated versus vaccinated. As more people get vaccinated in Maine and across the country, a small, rare thing that happens, getting COVID and landing in the hospital, when you multiply the rarity of that event times a lot of people, those who are fully vaccinated, the numbers start adding up. Some of this may have a little bit of a component of waning vaccine efficacy, but it's mainly driven by this base rate effect.
Okay. And then, sorry, there's just one last tiny point I wanted to ask about this. I apologize. It's just, I would imagine that if we're seeing that happen with vaccinated people, why are we not seeing the same proportion with unvaccinated people, also that kind of rate increasing?
Oh, the rate of hospitalizations among unvaccinated individuals has actually gone up significantly just since in the past several weeks in Maine as well as nationally. So again, if the best thing that folks can do to stay out of the hospital with COVID is get vaccinated, without question.
Great, thanks.
Thanks. Let me go to Emily Bader at the Sun Journal next.
Hi, good afternoon. So I wanted to go back to what Brian Sullivan started about talking about the healthcare system come October 29th. So a testimony from Central Maine Healthcare CEO Steve Littleson, he said, quote, our healthcare system has been battered financially by the pandemic, and we are in no condition to withstand the perfect storm that lies ahead after October 29th. He was talking specifically about workforce shortages and the financial impacts of that. So I just kind of wanted to ask Commissioner Lambrou again about what kind of supports will come October 29th should this happen. And if you can go into a little more detail about what exactly staffing ratios, on-the-job training, what that means for a healthcare provider.
Sure. And I would just say, going back to, I mean, we do work one-on-one with any facility that is experiencing staffing shortages that lead to service disruptions. And I think that's something we've been doing with Central Maine as well as a number of facilities across the state. That's just what we do. Again, there are these categories of flexibility with different, again, each setting is different. A trauma surgical unit is different than a pediatric neonatal unit, which is different than other sorts of parts of hospitals, which is clearly different than what happens in a nursing facility. So there's no cookie cutter formula for how we do it, but our toolkit includes these elements. Flexibility. What can we do to ensure that the staff that are there are maximally used, and how they bring people on in the short run? 2 is the financial support. I mean, just again, talking about hospitals, we put out $25 million this summer for hospitals and nursing homes. Another $146 million, $43 million is going out September and October in the coming days, that will make a big difference, because then again, they can turn around and use that to try to figure out how do they recruit, how do they retain, how do they make sure that those critical staffing gaps are met. I think the third is kind of connecting them with recruiting resources. A good example is, when we know there's a particular type of shortage of a provider, we have a team of people who might do kind of a connection and say, oh, well, that staffing agency may be able to help you. Or we know different hospitals in the state who may be able to have some sort of mutual aid agreement to begin to fill those staffing gaps, as well as retention. One of the things that we've learned is some of the problem with this workforce shortage is burnout. It is retirement of an older population. It is people leaving the field or leaving the state. We know that retaining people is critical. So, how do we figure out those supports and best practices that work? So we do an all of the above strategy with our facilities. It varies specifically based on what the particular staffing needs are, but we stand ready to continue that work in the coming weeks and months.
Okay, thanks. And, I hear what you're saying about all, financial supports, recruitment, but those things could take time, right? So, if there's an incoming class of certified nursing assistants, for example, it takes time. So is there a contingency plan? October 29th, that's the cutoff, to fill in the gap maybe between the weeks and months when those, that help from the state kind of really takes hold.
There is no single contingency plan because each facility has different needs. And I would note as a reminder, to date, we really have seen one hospital talk about reducing its services. We're working with our nursing facilities as, they are looking at their staffing availability. We do have programs that, again, are quicker than others. A good example is we have kind of training programs for people who are training to become a certified nursing assistant. That is an 8-hour training module that could put people on the job within a week. We do have those sorts of options that are available to facilities. And again, it just is one of those things where we stand ready to work with any facility to make sure that Maine residents have access to care. But we feel confident that our leaders in our healthcare system will do what they've been doing, which is provide the high quality, accessible care that they have throughout the pandemic in the forward-looking weeks.
Okay, thank you. And Dr. Shah, I think this question is for you real quick. I am aware of a couple of outbreaks at nursing homes in our region, as well as the Paris town office. And those are all, high traffic areas, especially town office. This might seem like a question that we should have asked in March 2020, but is there any sort of system or, notification besides contact tracing to inform people of outbreaks? Someone may not have gone into the Paris town office, but they might not be aware that there's an outbreak currently.
The contact tracing is really the mainstay of that. Of course, we encourage folks who facilities that are undergoing an outbreak or anything of that nature to make sure they have communicated with anyone who may have been in the building. But contact tracing is the principal mechanism through which we identify individuals who may have been in a facility, public or otherwise, to let them know that they may have potentially been exposed. We try to narrow down the window as much as possible so we're not needlessly scaring folks, but also targeting individuals who may have been potentially exposed to make sure they know that they should get tested, et cetera. That is the essence of what contact tracing is.
Okay, thank you.
Thank you. Let me go to Megan at WMTW next.
Thank you for taking my question. The Biden administration announced sort of how it's going to roll out the vaccine for kids 5 through 11, if in fact it is given approval by the FDA and CDC, or, the thumbs up to go ahead. And, in the beginning, you kind of talked about some of the things that we're focused on, including, which was similar to what the administration is saying, focusing on schools, pediatrician's office, et cetera. Well, that's different than the adult rollout. So, and also I think with this one, there are smaller needles, smaller vials, things that are different. So does that present logistical challenges, because it's not the same kind of thing is it the same as before with adults? And are there logistical challenges, and how are we tackling them?
Well, Megan, there certainly are logistical challenges, but we're up to the task. I'll talk about this in a minute. In terms of the Biden administration's plan, we reviewed that plan and we're delighted to see that the approach that the White House has recommended that states take, utilizing a school-based approach, was already what we have been planning for several weeks now. So we're delighted to see that the Biden administration is endorsing the approach that Maine is taking with respect to COVID-19 vaccines. It's not the only approach. As I mentioned, lots of other channels were opening, but that is the mainstay. We were pleased to see that endorsement. In terms of logistical challenges, there are logistical challenges here. This is, much as we've done with other vaccine efforts, a lot of moving pieces, but our numbers speak for themselves. Mainers are up to the task, and we'll get this one done. There are a few differences with the childhood vaccine that are actually opportunities for us, Megan. You noted some of them, somewhat different packaging and such. I want to zero in on two that are really important. The first is that the vaccine need not live in that ultra cold environment. You know, Megan, you've been covering these briefings for as long as we've been doing them. You remember 9, 10, 11 months ago, we were all focused on the Pfizer vaccine needing that ultra cold storage. We've learned a lot about that vaccine and its stability. And we now know that that vaccine can live in a regular refrigerator for 10 weeks. That opens up so many different avenues for how the Pfizer vaccine can be deployed in the field. The second thing is the size of the package that is ordered from the Pfizer vaccine. Early on, it was in lots of 1,170 doses. Makes it really difficult if you're a small physician's office to know you've got to use that many vaccines. But now it will be ordered initially in lots of 300, and then in 2 weeks from now, 2 weeks after approval, down to 100. Again, both of those changes will make it logistically much easier. And when something becomes logistically easier, it means we can get that much more coverage across the state.
And the response from schools is good, is positive?
Absolutely. We have a joint team of Maine CDC, DHHS, with DOE teams, and they've been fanning out across the state, region by region, touching base with every school administrative unit and every school to check in with them on their plans for vaccination. Would they like to have a clinic? Do they need a provider connected with them? When would they like to schedule it for? How many kids do they have between the ages of 5 to 11? The response from schools, as it has been throughout the pandemic, has been uniformly positive. And I'm so delighted for the partnership that we have with schools and school officials.
Thank you.
Thanks, Megan. Patrick Whittle, over to you.
Thank you very much. I was going to ask about healthcare workers, but I feel like we've more or less covered that at this point. Fairly soon, the border with Canada will reopen to travelers. What is the state doing to prepare for that?
I can start. Oh, go ahead, Commissioner, please.
Well, I think
okay. Patrick, one note there, Patrick, is that as we understand, of course, as you know, Patrick, this is managed at the federal level, but for visitors and friends and colleagues from Canada who will be coming into the United States, they will have to be fully vaccinated or receive some, actually, I don't know what the testing requirements are. I need to check those, but full vaccination, I know, is a major component of that. So it's not as if there is post-arrival testing that would need to be done. But Commissioner, let me turn it over to you.
I was just going to generically say that we are working on expanding our testing capacity, just knowing that that's been a strain on our border counties, especially Washington County. So we continue to work with our local providers to see what type of testing do they want to do? What kind of testing support can we provide? And how do we just expand those testing options? We don't yet have real specifics on how that testing expansion will be happening, but it is absolutely in the works.
Okay, good to know. I'm going to allow you to move on to the next person, as my other questions have already been dealt with. Let's go Red Sox.
Thanks, Patrick. Evan Pop, over to you.
Hey, Dr. Shah, thank you. So we've heard from some folks who have been doing door-to-door efforts to encourage people to get vaccinated. that not having childcare to get the shot and recover from potential side effects is a big issue for folks who are willing to be vaccinated but maybe haven't yet. And I heard Commissioner Lambrou mention childcare in the context of healthcare workers, but I was wondering if there are any kind of short-term childcare options available to others who want to get vaccinated, and if not, if the state is considering kind of any such initiatives.
Thank you for that question. I mean, like the federal government, the state of Maine has been encouraging any employers encouraging employers to offer paid leave for workers who are getting vaccinated, so they have the opportunity to get to the clinic, and if they need to recover. In addition, we've been encouraging employers to treat any sort of downtime after a vaccination with symptoms as paid sick leave. So we continue those policies. That would be the best way to really try to support those families. I'm not aware of any kind of really like one-day types of childcare supports that we offer for people who are having some sort of side effects or effects of the vaccine, but we're certainly happy to look into it. I'll flip it around. We do work with our community groups who are facilitating some of these vaccine clinics to provide whatever type of stopgap temporary supports, not just for people who have COVID-19, but also for people who are getting vaccinated. So there are some of our community groups that are providing some sort of short-term relief. But Director Shah, did you want to add anything to that?
No, I was going to pick up on the exact point, Evan. That's certainly a challenge. And throughout the pandemic, we've been working with various community groups across the state of Maine to provide assistance and support in the specific situation you outlined, Evan, childcare, and then if someone's feeling crummy after they get their shot, but even more broadly for support during quarantine, during isolation. And as the commissioner noted, that's something that we can look at and look into to see if there's more that needs to be done.
Thank you.
Thanks, Evan. Mal Meyer, over to you.
All right. Thank you, Dr. Shah. My question is about the legal battle over the mandates. And there was a recent ruling that happened with the appellate courts. I want to start at why didn't the state provide a religious exemption for the vaccine mandate?
We're not allowed. The legislature in 2019 removed that exemption from Maine law.
Okay. So, the appellate court did effectively uphold the vaccine mandate, did not allow for a temporary stop to it. Or is the state prepared to continue to fight to this all the way up to the Supreme Court? It sounds like the Liberty Counsel is willing to take it that far.
Mal, yes, is the bottom line answer. You're certainly aware of the statement that Governor Mills and the Attorney General put out, but I think the bottom line is yes.
What do you make of the appellate court's decision? And this can go to Jean Lambrou, Commissioner Lambrou. What do you make of the ruling from the appellate court?
Sure, and I will say that the Office of the Attorney General may be more versed in responding to the legal decisions of these courts. I'll just repeat what Director Shah said, and in the words of the Governor and the Attorney General, we're pleased. We believe that the original district decision that looked at our law, looked at our backup for why we were doing it and how we were doing it, and upheld the law was ratified by the appellate court. And so we are grateful that people took the time, looked at the evidence, looked at the laws, and made those decisions.
Thank you.
Thanks, Mel. Amy Brown, over to you.
Thank you, Dr. Shah and Commissioner Lambrou. I have a couple of questions from listeners, or a couple of sets of brief questions, one about boosters and one about masks again. People are wondering how much the boosters increase protection and whether or not it takes 2 weeks for them to become fully effective.
Sure. Amy, it does vary person by person. Someone who has significant health issues, the boosters will afford them that much more protection. But in general, for the categories of individuals in whom boosters have been authorized, those who are 65 and older, those with health conditions, et cetera, the evidence that we have and that was reviewed by the US CDC does show that the booster of the Pfizer vaccine does just that. It boosts the body's immune system and prepares it to deal with the COVID virus in the event that it sees it again. To what extent does it do so? That varies quite a bit by population, but it was significant enough statistically and clinically to warrant both the FDA and the CDC signing off on it.
And does it take 2 weeks for that protection to kick in?
It happens gradually, and so the first effects can be seen as soon as the 5th day after the booster. But for the full protection, as with the second dose, it takes about 2 weeks. But again, it's not as if the night of the 13th day is when it all happens. It happens in a gradual, stepwise fashion.
Okay, great. Thank you. And about masks, there have been more articles floating around lately about studies that have compared different kinds of masks and are actually saying that it's time to give up the cloth masks, that surgical masks and legit non-counterfeit KN95s are preferable. And a listener wanted to know, specifically with the Delta virus still pretty prevalent in Maine and people starting to move back indoors, if cloth masks are just a tiny bit of help, if people should be shifting over to surgical masks and K95s, or what do you think about that?
Yeah, that's a good question, Amy. I'm going to just summarize where we are. I don't want to suggest that I'm changing recommendations, because the recommendation is that you wear a face covering when you're in an indoor public setting, when you want that extra measure of protection. Any type of face covering will do the job, even in light of Delta. That being said, there have been some recent papers, as you've mentioned, that have started to show some differences between types of masks. One in particular came from a quite well done study that was done in Asia. And they did find that all other things equal, a surgical mask does a little bit better of a job than a cloth mask. Does that mean you should chuck your cloth mask out the door? No. Surgical masks can still be difficult to find. They can be pricey. So I don't want to suggest that everyone should uniformly move away from a cloth mask in favor of a surgical mask. If everything else were equal, a surgical mask probably affords a bit better protection, but don't feel bad and don't feel the need to abandon your cloth mask. It is still doing a very good job.
And the KN95s and surgical masks are roughly equivalent?
Well, yes, and that has to do with the manner in which people wear the KN95 masks or N95. To really get maximum benefit from an N95, you have to go through the full fit testing process that, Amy, you're aware of. You've been covering these for a while. But without going through that fit testing process, they're a bit marginally better than a regular surgical mask. But again, they're pricey, and they may not be affordable for everyone.
Right. Thank you.
Thanks, Amy. Annie from Spectrum News.
Hi there. Thanks for taking my question. It feels kind of crazy early to be asking this, but it is kind of getting toward that time of year when we're going to have college kids traveling for the holidays, kind of for the first time for real since, this all began. I wonder if you're asking schools to do any special precautions or procedures around the travel season for the holidays, and if you have any concerns about impacts to case rates or infections from that next couple months.
Well, Annie, I thought when you said crazy earlier, you were going to be asking about Halloween or the holidays.
Right.
So I have to scrap all my Halloween puns. That's fine. But in terms of college kids, we haven't seen any specific guidance from the US CDC on this front. And certainly it's a national concern because college kids would be traveling everywhere. But, at least here in Maine, the vaccination rates of college students are remarkably high. And that gives me a lot of safety, because even to the extent those kids would be traveling away from Maine and then other Maine kids coming back, we've seen really high uptake rates of the vaccine. Indeed, many colleges and universities require them as a condition of being a student. As a result of that, the migration of kids coming to and from different states for the holidays doesn't give me a lot of concern, but we will see, because that's still, as you say, several weeks away.
And do you have any Halloween puns or guidance you'd like to throw in there from your notes?
Oh, no, I can't. You can't force puns. Over to Eric Russell.
Thank you, Dr. Shah, Commissioner Lambrou. A lot of questions have been asked, so I think I've only got one. Talk to me a little bit about the messaging for parents for vaccinating their children. I feel like it might be a little bit different, or maybe not, than the messaging we've had for adults who might be vaccine hesitant. I think there are parents, even many parents who've gotten the vaccines themselves, who are still a little bit reluctant or hesitant to say, I want my child to get the vaccine, especially because we have lots of data to suggest that it's still a relatively mild illness for kids. I mean, by and large, the deaths, the hospitalizations, thankfully well, not thankfully, but they've been confined to the older populations and people who are immunocompromised, et cetera. I know there are some kids in the immunocompromised category too, but at any rate, considering all of those things, how do you plan to message this out to folks as we get closer and closer to vaccinating this group of kids?
Sure, I'll start, but Commissioner, please. Commissioner and I have discussed this on numerous occasions, Eric. And let me start by noting that you're generally right. It is a different approach to messaging. You're also right in that there are some early data to suggest that even parents who themselves were vaccinated may have questions, concerns about vaccinating their children from the ages of 5 to 11. So right off the bat, the first phase or the first element, Eric, starts with the safety of the vaccine. And that's what the FDA and the CDC will be vetting and kicking the tires on really hard to make the case publicly, transparently, that the vaccines are safe. There are two elements of the messaging that we're really focused on. The first is utilizing vaccines as a way to make, hopefully, the second half of the school year a lot more normal and a lot more like what we saw in 2018 and 2019. Widespread vaccination helps us get there. For example, a 7-year-old who's fully vaccinated, if they're exposed in a classroom, the child doesn't need to quarantine. They may need to get tested, for example, but the quarantine process that we've seen occur across the state, across the country, can be bypassed if the child is fully vaccinated. So right off the bat there, the school year, the latter half of the school year presents an opportunity. And then finally, to the point you mentioned, Eric, thankfully, children are not as severely affected, but they can be carriers of the vaccine. And so as we get into the winter holidays, we've got kids interacting with their grandparents. We want those interactions to be as safe as possible. One of the ways to achieve that safety for the winter holidays and beyond is for everyone who's gathering to be vaccinated, everyone who can be to be vaccinated. This includes, of course, those who are 5 to 11. The more kids who are vaccinated, the better off we'll be. Finally, and then I'll turn it over to the Commissioner, Eric, although when we talk about the severity of who's affected and how kids are affected, we sometimes focus on things like hospitalizations and deaths. And we say, well, that's a rarity. But the truth is, Eric, any hospitalization of a child is and should be a rarity. Any death of a child is and should be a rarity. We still don't know what the full scope of long-term interactions and long-term consequences of COVID will be in kids. We don't yet know to what extent kids will suffer from long COVID, but the data that we have from adults suggests that vaccination there too will help avoid that.
And I'll only add that we also will probably try to ask kids what messages will work for them, recognizing that they're the ones who talk to their parents. They're the ones who may be interested and have these questions and want to ask both, is it trying to keep themselves out of hospitals, or is it trying to get them out into the playing field or into band or into like play dates? So we will be engaging with kids in Maine as well to figure out what they think will be effective messages once we have these scientific data to show that the vaccine is safe and effective.
Thank you both. That's all I got.
Thanks, Eric. Over to Ryan from WAGM.
Hi, thank you. So in some previous briefings, we've talked about the struggle to vaccinate in rural areas. It seems like in Aroostook County, that trend hasn't been quite the same, though we've been seeing some higher rates of vaccination. If that's still the case, could you talk to us to why that is? What is the difference with Aroostook County's approach to vaccines compared to some other rural areas?
I can start, but again, Commissioner, please weigh in. So Ryan, first of all, you're right insofar as vaccination rates in some of our rural counties have been a bit lower, but they're still quite good relative to other states. But Aroostook County is coming in at just about 60% of its entire population being fully vaccinated. It's in the same neighborhood as Washington County, even the same neighborhood as Kennebec County. So I don't know that there's structurally anything that's been different in the county. Indeed, and Commissioner and I remember these days back in January when we were first getting the vaccines. Some of the most organized and ardent providers in the state of Maine were providers up in the county. Providers all the way from Fort Kent with Northern Maine Medical Center, A.R. Gould, Holton Regional Hospital, to say nothing of the FQHCs and others in the area, were the first ones who came together to say, we will get the job done in the county. And at a time of the year when travel was difficult, et cetera, they got the job done. So I don't know that there's anything structurally different, to be totally candid with you. But Commissioner?
I'm just going to add a shout out to some of the local organizations in the county. We know, for example, that there was a real effort to try to use the Area Agency on Aging in Aroostook County to vaccinate homebound people, to try to get to those hard to reach populations. It is an older population in Aroostook County, and they did a just very good job early and aggressively about trying to get to some of those people with greater challenges in accessing vaccine sites in a very rural county. So thank you.
Yes, I'll add to that, as we're talking about childhood vaccinations now and planning for schools. Same response that we got back in January, we're seeing from the county when it comes from school-based planning. In addition to the groups I've mentioned, 2 independent pharmacies up in the county, Hebert's and St. John's, have really stepped up to say they will help us get the job done. So it's really a team effort, and it's the essence of community. So we're very thankful for that. Let me go to Leah Russell at the Bangor Daily News.
Oh, thank you, Dr. Shah. I believe my questions have also already been answered, so I will kick it to somebody else.
Okay, thanks, Leah. And Patty White.
Thanks very much, Dr. Shah and Commissioner Lambrou. Can you just talk a little bit about why we're seeing an increase in hospitalizations other than pockets of unvaccinated people? Is it colder weather and people hanging out indoors? Is it because patients can't be discharged? What can you tell us?
Patty, I'll start, but again, the Commissioner and I have had discussions amongst ourselves as well as with others. The first thing I'll note, Patty, is it seems to be a bit more regional. I've spoken with counterparts of mine in a number of other New England or Eastern Coast states, and they too, not just health officials, but doctors on the ground, are seeing this uptick in hospitalizations after a decline 2 weeks ago, now a bit of a resurgence over the last 7 to 9 days. So it's not necessarily a local phenomenon driven by local factors. It seems to be a bit more regional. Some of the hypotheses that you noted, Patty, are the ones that we as a group of public health folks are looking at. It could be the onset of chillier weather. We're looking at whether there was a particular stretch of weather that shoved people indoors 2 weeks ago that may have led to what we're seeing now, or 3 weeks ago. It doesn't look, as we've looked at those hypotheses, it doesn't appear that there's one unifying explanation, which suggests that maybe we are in a position to what the UK has been seeing, which is this sort of seesaw up and down pattern with cases, although they haven't yet seen it with hospitalizations. Bottom line there, Patty, it's something that we're looking at. There doesn't seem to be a single explanation, but it's concerning.
Okay, thanks. And I've got a question about kids and vaccinations. The vaccination rate for 12 to 15-year-olds in Maine, I think, is around 56%, which is the lowest compared to other age groups. So why do you think that is, and how does that play into the effort to make sure there's robust demand for younger kids when they can get the shot?
I'll start, but again, Commissioner, please weigh in. I think it's a constellation of two of the factors that Eric Russell I chatted about with him. I think it's a perception that that COVID, thankfully, is not as serious in the short term, although in the long term, big question mark about what we know about long COVID in kids. We know they can be affected. We just don't know the frequency and the severity. But there is a general perception that COVID in children is not as severe as it is in adults, which decreases the urgency of the vaccine. The other, I think, Patty, that's driving the lower rates of vaccination in that group, the adolescent group, is the same concerns about the fear of the unknown and the long-term side effects of the vaccine. Even among parents who themselves are fully vaccinated, we're seeing that their children, they may not wish to have them vaccinated. I think for us, that's going to be a communication, that's going to be a job of our communications teams to really make the case for why parents who have been vaccinated should apply that same approach to their own kids. I think personally, those are the two things that are going on. But Commissioner?
Look, I think we're going to once we see the recommendations from the Food and Drug Administration and the US CDC, if they, with a review of additional information, looking harder at what's going on with the vaccination, do authorize the vaccine for the kids 5 to 11, that's a new opportunity for us to go back to those parents to talk about the safety, the evidence, the two sides of the safety equation. Are you at risk from getting the disease, or are you risking getting the vaccine? And I think with that fresh opportunity, with the news coming out of these official scientists in the coming weeks, we are hoping to go back to those same parents to try to encourage them to take another look, to look again, to see what these two sides of this equation show you in terms of health and safety. And I think with the data we're seeing out there, be convinced that it is the right thing to do to get their children vaccinated.
Patty, the last thing I'll note, and we've noted this on these briefings, those numbers can be changed. If you take a look back at surveys that were done a year ago of adults, asking them their willingness to get vaccinated, what you saw people say back then versus what we see now in the data are thankfully different, insofar as more people are getting vaccinated than initially said that they would a year ago. The same opportunity is there for children. A lot of this depends on trust. As we know, trust is something that's built one conversation at a time. It's not a switch that we flip on the wall. It's something that we have to work at, something that we have to do deliberately and seek out and build as we go along. I think we can do it because we've demonstrated in Maine that when we speak to folks, talk to them about what's going on, we can build that trust. I think we can do the same thing with childhood vaccinations.
Thank you.
Thank you. And that takes us to the bottom of our hour. Commissioner, any final things from you before we adjourn for the afternoon?
I'm just going to go back and say a quick thank you, because we talked about these vaccination efforts, the school-based clinics that are being organized, our EMS agencies have been organizing clinics, these independent pharmacies. The people of Maine have really risen to the occasion. We would not have one of the best vaccination rates in the nation without the volunteers, without those providers, without people working nights and weekends. So we thank them for what they've done, and we look forward to this next potentially exciting phase where we get to, for the first time since April, extend eligibility for the COVID-19 vaccine to these younger children. So thank you, and thank you in advance for the work you're about to do.
Great. Thank you, Commissioner. Thanks to all of our colleagues in the media today for helping us keep on time. Very much appreciate the questions. And thanks to all of you taking some time out of your afternoon to join us. We very much appreciate it. We look forward to chatting again soon. In the meantime, as always, please be kind and take care of one another. See everyone soon.